And we're back. Our guest on this segment is Patrice Pratt with the Community Service Council. The topic, homelessness. Welcome, Patrice. Good to have you back.
Thank you, Sam.
It's been a long time since you've been with us.
It has been. It's been a few years.
Are the numbers in terms of homelessness folk out there on the increase?
Unfortunately, the answer to that is yes. So we did at the Community Service Council recently did a longitudinal study where we looked at the increase or decrease of homelessness over the last 10 years, and we're actually up by 7%. And that's despite all of the incredible work that so many homeless service providers have done in our community. It's despite housing just over 1,000 veterans and individuals experiencing chronic homelessness in the last 2 years. It's despite all of the intensive collaborative efforts that we've done with 23 plus organizations across the community. Homelessness is a symptom, it's not a cause. Like that, homelessness means that our state, the current budget crisis that we're in, our lack of affordable housing, you know, it costs somebody over almost $14.50 an hour to work 80 hours a week at $14.50 to afford a 2-bedroom apartment. We have folks that can't access mental health services. Folks with mental health, they die at a quicker rate. They die 27 years earlier than the rest of us that don't have mental illness.
The ones with mental health issues?
That's right. That's right. We have kids that are doubled up, couch surfing. Tulsa Public Schools and Union Public Schools, their counts are down a little bit, but still you're talking about upwards of 3,700 students that are homeless, doubled up, which means 2 families, 3 families, 4 families living in the same household. Or we've got young adults. We have young adults that are being booted out of foster care when they turn 18. Recently, our young adults that we surveyed during the annual point in time count, which is where we on January 25th, we go out and we survey as many folks that experience homelessness as possible. 1 out of every 3 of them came out of foster care. So homelessness is a symptom of a much larger problem that's happening in our state and in our community.
One of the things that I've discovered about the folk who fall into the category of homelessness, they come from all walks of life.
Absolutely.
Some of them are chronically mentally ill. They're going to stay that way until they get professional help, which is doubtful. But then there are others who choose to be that way. There are others who are victims of something like you just mentioned. Some of them are highly educated. I met one just recently with 2 master's degrees and found himself unable to get a job and provide for himself, and chose this life of living under a bridge.
Well, let's talk about that choice for just a minute.
Sure.
So first of all, homelessness, 1 or 2 catastrophic events, somebody could find themselves homeless.
Just like that.
Just like that, that's right. It doesn't matter what degree you have or whether you're literate or not. Homelessness does not discriminate. It doesn't discriminate. It's a loss of home. A loss of home. And there's all those contributing factors, but at the end of the day, it means somebody doesn't have a home. For those that I hear often people choose. In our experience, in fact, when I was here with you last, we talked about our Pathways model, which is an intensive case management model that uses the Housing First philosophy. And Housing First says that, you know what, an individual does not necessarily have to be enrolled in treatment in order to deserve housing. That we have found that getting folks into housing and wrapping those services around them, they are much more likely to seek treatment. So sometimes what happens with folks on the street, they get approached, and they get approached by a lot of people, right? You have faith-based organizations, you have social service organizations, you have law enforcement. They're approached by a lot of folks. And so sometimes what they say is, I'm not interested. I'm not interested. And that, in our experience with working with those that are the most chronically ill, that have been homeless the longest, is that that's not necessarily true. What they're not interested in is going into homes that maybe have restrictions on their behavior. where maybe you have somebody who's suffering with alcoholism, you know, and rather than treat it like a public health crisis, like a substance use disorder, it's that they must be in treatment, and they choose not to do that at that time. And so unfortunately, housing doesn't come with that. And so for folks that in Housing First is about getting them in housing, wrapping the services around. And we have found folks that have been out there a really long time that are willing to go into housing and willing to seek treatment. It's just sometimes folks, they don't want to deal with all the rules. And so they'll say, I choose this, or I'm not interested. But I think with persistent, reliable, trustworthy relationships as part of outreach, which we're doing with the Way Home for Tulsa, which is our community-wide collaboration and collective impact. We have a Way Home for Tulsa has a coordinated outreach team that's going out every week to cover all 4 quadrants of the county. Part of their work is building that persistent, reliable, trustworthy relationship with the individual so that they would be more open to accepting housing, especially some of the housing that doesn't come with conditions for treatment. So,
the other end of what I said a moment ago about the fellow with 2 masters is the man or woman out there with maybe only a 3rd grade education,
right,
who doesn't come equipped to do anything else, who doesn't know which way to turn. How do you get word to them about this wraparound concept?
So somebody with that 3rd grade education, you know, one of the challenge for them is that they are most likely not going to be able to afford housing. Minimum wage, right? Let's say a mom with 2 kids. That goes back to that 2-bedroom conversation that we had. She'd have to be working 80 hours a week and make $14.50 an hour in order to afford that 2-bedroom apartment. So how do we get the word out there? We collectively as a community in our collaborative impact model are prioritizing families, that mom, into available housing that may have subsidy or it may have support services. And we're doing that through our coordinated entry system, which we call All Doors Open, which is really a game changer. It allows our community to start to prioritize folks into housing based upon vulnerability and need, instead of first come, first serve. So now that mom that is the most vulnerable, anytime we've got kids out there, right? None of us want to see the children on the street. We don't want to see kids in the shelter. We want to see kids in housing with the support services that they need to be able to thrive. So through coordinated entry, we're able to not just those that are literally homeless, but we're able to shift some of that focus now on prevention and diversion. You asked me about numbers being up. So imagine a pipeline, right? We've been doing all this work downstream with these folks that are chronically homeless, and they cost our system an enormous amount of money. And then you have this pipeline, this inflow of people, because of the current state of our nation and our state and our counties and all those contributing factors to homelessness. Well, they keep feeding this pipeline, right? And our numbers aren't going down because of this inflow that keeps happening. So with coordinated entry, we're trying to equally shift our focus on prevention and diversion. So prevention is that mom who calls and says, you know what, I've just lost my job. I need to get connected to work services right away, or I'm not going to be able to pay my rent that month. And through our 360-degree referral system that we're implementing community-wide, folks can actually get connected immediately to the providers that provide that service.
Let me interrupt you for just a moment because we're quickly running out of time, and I want to get this on the table.
I have lots to say.
I know, and I want to hear as much as I can. But if we have so many facilities anxious to help and trying to help and helping,
right,
and the numbers are continuing to grow, there are people that are going to watch this and hear everything you say right now, saying, what can I do? What can they do?
Well, you can certainly go to the Community Service Council's webpage at csctulsa.org, and under A Way Home for Tulsa lists all of the agencies that participate in this effort. Any of those agencies would certainly, you can donate. You can reach out to explore volunteer opportunities. You can certainly reach out to me and we can help connect you to those opportunities, or through your faith-based organization.
And that's the Community Service Council.
It's csctulsa.org.
Got it. We're out of time.
Thank you so
Thank you, my
much.
dear. It's good to see you
It's
again.
a pleasure. Thank you.
We're all out of time. We'll see you next time. Thanks for joining us.